Ever pondered the intricate dance of life and death? Or how a simple act of pumping a chest or blowing air into a mouth could mean the difference between the two? Today, we dive into the life-saving techniques of cardiopulmonary resuscitation, or CPR, and basic life support, or BLS. Cardiopulmonary resuscitation, more commonly known as CPR, is a life-saving procedure performed during many emergency situations, including heart attacks or near drownings. The procedure involves chest compressions and rescue breaths to maintain the flow of oxygenated blood to the brain until further medical treatment can restore a normal heart rhythm. The first step in performing CPR is to check the person's responsiveness. Shake or tap the person gently and ask loudly, "Are you okay?" If there is no response, it's time to call for help. Dial your country's emergency number and put the phone on speaker so the dispatcher can guide you through the steps of CPR. Next, begin chest compressions. Kneel beside the person and place the heel of one hand on the center of the chest. Place your other hand on top, lacing your fingers together. Keep your elbows straight and your shoulders directly above your hands. Use your body weight to push straight down on the chest at least 2 inches, but not greater than 2.4 inches. Compress at a rate of 100 to 120 compressions per minute. That's almost 2 compressions every second. After 30 compressions, it's time for rescue breaths. Tilt the person's head back slightly to lift the chin, pinch the person's nose shut, and take a normal breath. Cover the person's mouth with yours, making a seal, and give 2 breaths. Each breath should take about a second and make the chest rise. Repeat these cycles of 30 compressions and 2 breaths until the person starts to respond or help arrives. On the other hand, basic life support, or BLS, is a broader scope of emergency care, which includes CPR. BLS might also involve using an automated external defibrillator, or AED, maintaining an open airway, clearing the airway of any obstructions, and even providing supplementary oxygen. To sum up, CPR and BLS are vital emergency procedures that can mean the difference between life and death. The key steps to remember for CPR are to check responsiveness, call for help, start chest compressions, give rescue breaths, and repeat. For BLS, remember it encompasses CPR and might involve the use of an AED, maintaining and clearing an open airway, and providing supplementary oxygen. Remember, these skills are not just for healthcare professionals. Anyone can learn, and by doing so, you might just save a life. Because when it comes to these techniques, every second counts.